we have an hour and 45 minutes to dig deep into some of these resilience interventions. It was really hard for me to choose my favorite interventions to teach all of you tonight, because when I train the pediatricians, they learn about 15 to 20, and care managers learn about the same amount. And there's so many that I have in my back pocket at any given time that build resilience in families. And in fact, somebody came up to me just now during the break and said, oh, it'd be really great if you talked about this. And I'm going to try to touch on that too. But so I'm excited to teach you these, and I'll throw in extra little hopeful little rays of sunshine as well as we go through it. But I had to pick some to start with. And so these are really what I would say they're the biggest bang for your buck, if you will, in terms of building resilience. And they're the ones that I'm getting the most positive feedback from the providers as I hear back from them. But let me first talk about how I created them. So like I said, we wanted all the pediatricians to know about ACEs. We wanted all offices to be compassion informed, and now you know what it means to be in a compassion informed office. We wanted all of them to understand what resilience was and how to build resilience in kids and in families. And then Dr. Mashofsky, who's one of the pediatricians, said it'd be so great if somebody could develop a curriculum where we could do one of these resilience interventions at every well child check. And I was like, I can do that. And so what began was this wonderful relationship collaboratively between myself and a group of about 7 pediatricians, where we literally had lasagna at my house, and I kept throwing resilience interventions at them, and they said, yes, that will work, or no, that won't work, or we need more script for that, or no way, I'm not a therapist, I can't talk about that, or yes, more of this. And it was this really great collaboration that occurred between all of us. And then they brought things that they were using at their offices, and I gave more. But the basic premise is this: because I'm a licensed psychologist, I know what trauma-informed care is. And I know what builds resilience in kids. So what I did is I took interventions that I would use in my office in 6 weeks or in 8 weeks or in one session even, and I tried to boil it down to a 2 to 5 minute resilient intervention that your pediatrician could use in his or her office. Whew. So I'm going to teach you some of those tonight, but I want to underscore this. These interventions are meant for any age group, right? So whether it's a 2-year-old or a 12-year-old or an 18-year-old, and they're meant for any type of parenting or interaction. You're going to find ones that you feel like really work well for you tonight that you can use right away, and others that you're going to have to come back to, which is a good reminder. This video link is going to be sent to you. The video that we're taping tonight is going to be sent to you after tonight's event so that you can go back and watch it. You can watch this again and again and again. Lucky you. But some of it will really stick with you. Others you'll have to go back to and be like, okay, right, well, how did she say to talk about that? One of the biggest things I hear from the pediatricians is, I am not like you, I don't talk like you. And so the nice thing about being able to go back is to hear some of the language over and over again in a way that's delivered in a way that I think is really good for kids and families. So lots of breadth and depth to be able to use for lots of different families, lots of different age groups. And as I'm giving examples, I'm going to try really hard to talk about how you could use this with a toddler or a middle-aged child or a teenager. But if I don't, and you've got a kid who's like 14, you're like, how does that apply to my kid? Please just stop me and raise your hand. That's why we have more time for the actual interventions. So I think that's what I wanted to say about how these tools were developed. These are the big bang for your buck. Oh, and one last thing, right? Any conversation worth having is worth having many, many times with your children. So the circle of support intervention, one of the first ones we're going to do, isn't just something I talk about with kids one time and then never come back to. Or talking with them about how to use feeling expression or emotion regulation. It's not something we do just one time and I'm like, okay, good, you know how to talk about your feelings now, moving on. These are things that I talk to my kids and other kids in my practice about over and over and over. And that's why when we developed the interventions for pediatricians, we did it. Pediatricians are the only people who have access to your children outside of you from birth through their whole life. I counted 28 opportunities if you show up to all your well child checks that they have. So let's talk about the first one. Sometimes my clicker wants to work, sometimes it doesn't. Okay, doing it manually. Okay, let's talk about the circle of support. This is when I'm going to make Steve a little bit crazy here. So I'm just going to turn this so I don't miss anybody. Okay, here's the idea behind the circle of support. You can use this as a way to talk to your kids about people that are important in their life. I'm going to draw it out and show it how I do it with kids in my office. You don't have to do it like me, right? If I'm in an exam room with a pediatrician or with a pediatric patient, I might just do it on exam room paper. If I'm in my office, I do it on a clipboard. But if I'm just talking to my kid or your kid in a coffee shop, we could talk about it by drawing it. We could talk about it just verbally. It doesn't have to be formal, but it's just my way of presenting the information. Here's what the circle of support looks like. We all have 3 layers of support in our life. The primary circle of support are the people that you could call anytime, night or day. So if I'm talking to a mom of a brand new baby, I'm going to say, who are the people that you can talk to? Because when I'm talking about circle of support for parents of kids under 5, I'm talking about the caregiver. As kids get older, I'm talking to the actual child about their circles of support. But if I'm talking to a brand new mom, I might say, or a brand new dad, excuse me, Clinton's going to run out here any minute. He just told me during the break that his wife's due any minute. But luckily it's at this hospital, so if we see him get up and run, that's why. The primary circle of support are who are the people that you can call anytime, night or day, when your baby's crying and you're at your wit's end. 2 o'clock in the morning, that person will pick up the phone, they will answer you, they will help you, right? That's your primary circle of support. And so for a care provider, a mom, a new dad, it's often their parent, maybe their parent, their mom or dad, their spouse, or a best friend. When I'm talking about this with older kids, like teenagers, they'll often say, my best friend, sometime my boyfriend or my partner, or my mom or dad. Amazingly, I had a wonderful young woman in my office the other day, and I was asking her about her primary circle of support because her parents were worried that she was kind of depressed. And I said, well, let's just talk about who your people are. She's 16 years old. Who are the people that you could call anytime, night or day? Top 3 people she listed were all adults, all healthy adults. I looked at the mom and dad. I said, you've got nothing to worry about. She's calling other healthy adults, and they include you. Versus, I don't know, some of their teenage friends who may or may not give the best advice we'd like our kids to have, right? But those are your primary levels of support. Obviously, as a practitioner, what I'm looking for are red flags in that primary circle. Is the husband that you say your primary person is abusive? Is the parent that the child's referring to unhealthy or have a mental illness of some type? So for you as parents, right, when you're talking to your kids about who are their primary circles of support, you want to look for, are these people healthy? Are these people that I want my children to have in their life, that I want them to be going to and talking to about things? And then the secondary level of support are often people that you can call. They'll be there for you. But I say like not at 2 in the morning, more like 10 in the morning, right? Once they've had their coffee and they've woken up a little bit. So for parents, that might be, a friend of theirs. It might be a mom from a mother's group. And I'm writing these down. I know you can't all see it from that far away, but I'm writing them down as they talk to me because I want them to see it. Very rarely do we have time to just slow down and think about who are our primary circles of support and secondary circles of support. So it might be a friend, it might be someone from a mom's group, it might be a pastor, a rabbi, it might be a teacher at school of an older child. For older kids, again, it might be a teacher, it might be one of their friends, it might be a coach, it might be a pastor or a counselor at their school, it might be a friend's mom. And then the third layer, what we call the tertiary layer of support, are often the systems. And I usually say these are usually people that are paid to be in your life. So when I'm talking to providers, I say, sometimes that's you, right? And for moms and dads, that's often your medical provider or someone like me, a counselor or a psychologist, somebody that you can talk to and you get information from. Again, it might be a teacher, might be a neighbor or a community friend, but I'm looking for a couple of things. I'm worried if there's nobody here, right? I'm worried if there's nobody here. As parents, you're probably all thinking to yourself like, oh yeah, I know who my peeps are, right? My partner or my best friend. If you don't, as a parent right now sitting in this room, have someone in your primary circle, what I would say to you is, who is someone out here in the secondary circle that we could pull in for you? Without fail, you guys, when you ask someone on this circle, they are really happy, relieved, and willing to be your person. I can't even tell you how many times I've had somebody, either a parent like you or a kid that I'm talking to not have someone in their primary circle, and when we look in their secondary circle and I check back with them later, they're like, oh my gosh, yeah, I asked my neighbor who always brings me quiches. She was thrilled to come by and watch my baby. Or I was at a high school and talking to an AP Psych class, and a girl approached me after the class, you know, by all appearances, senior straight A AP student in Psych, and she said, Dr. Stober, I don't have anybody here. And so we approached her teacher, who had invited me to give the presentation, and Ms. Jeffrey said, I will be that person. Absolutely. I will be your person. We will get you through your senior year and through your college admissions. I will be that person. So never underestimate the secondary layer of support. This is where my interventions come from if there aren't healthy people identified here. Yes?
So if you're talking with a young lady or a young man, and you're identifying that primary, and it's not somebody that's healthy, or what you consider healthy, how do you combat that? I mean, how do you can't just say like, oh, that person can't be a friend.
Right.
Somebody else new for you.
Right. So
That's
Clinton's question's good, which is, if your child is identifying someone in this inner circle who's not healthy, what do you do about that, right? Because we all know when you say to your teenage son or teenage daughter, I really don't like so-and-so, what do? Marry them. Exactly. They marry them. So what you want to do instead is do reconnaissance strategy. That's what I call that, right? Rosalind Weissman, who runs a center for teenage girls down in Knoxville, Tennessee, talks about reconnaissance strategy. You want to become a good reconnaissance strategist, and you want to backdoor this approach and say, I really like these people that you mentioned. You know, I also like Chris a lot. She seems like a really good friend, or he seems like a really good friend. Why don't we have them over on Friday? I'll splurge for pizza and a movie. Invite people into your child's life that you want to be part of their life, and encourage those relationships, even if you have to do it subvertly, right? Don't be the house where kids aren't welcome and invited to, right? I know that we all have different reasons why we don't want to have, you know, loud, noisy teenage boys who eat a lot at our house. You want those people at your house because you're going to learn who these people are in their circle. I get worried and a little bit confused when parents don't know friends that their kids are talking about. There's going to be some friends that your kids have that you just don't know, especially as they get older, right? And they all have their own phones now, so they don't have to go through you anymore. Remember when your parents called? Remember when you were at home and people called and they had to talk to your parents first because there's like this thing attached to the wall? Well, now your kid has a cell phone, right? So they just call your kid directly. Or not even do that, they just text them. They never even have to really talk to them. And so there's a lot of people that your kids have access to today that you have no idea who they are. Even more important, why you know who this primary group is, right? So that when my son comes home from football, he's a 5th grader, and I said, where did you hear that word? Oh, from so-and-so. I don't know that kid. And I say, okay, so, but when you're hanging out with these other friends that I do know, are you using that language there? Well, no. I might think about that. So you can use their healthy primary circle as a way to talk about the behavior you do want also. And when they're experimenting with these friendships that are outside of that, pointing out that maybe that's a different kind of behavior. But back to Clinton's question, if there's somebody that your child's mentioning is not a healthy person, use some subvert techniques. And I will say one hard stop. If you know for sure that person's abusive to your child, and I mean abusive in an emotional or physical way that could do them long-term harm, you can put a hard stop on those things. It is okay as a parent to say, absolutely no, that person can't be in your life, and I'm going to tell you why. Because they're abusive. Not just a friend who you sort of don't like because they like say bad words or they don't have the same value set that you have, but somebody who's, you know, is toxic in your child's life. And you've heard from lots of parents or lots of other people, or you've witnessed those interactions take place. It is your job to protect your child from those people. Yes. Other questions about circle of support? You can all go home and try this out on your kids, right? Okay. This is just a kind of a tag onto this. When I was a doctoral student, my dissertation was on factors that help families cope and adjust to having a child with a chronic medical condition. And I did a qualitative study and spent hours and hours and hours with families to look at who their support systems were and how they coped to having a child with medical condition. Mothers were often able to identify 3 or more primary support systems. Usually is their spouse, and then their mom or a friend or another person from a group, or dads had one. Guess who that was? Their wife. Right. Not a bad thing. Not a bad thing. Except they had no other support system. In fact, most of the dads that I talked to, their coworkers had no idea that they had a child with a medical disability. So they didn't feel like it was okay to talk about that at work or ask for time off or go to medical appointments or say, hey, I got to be with my wife today. She needs a break. Dads get really isolated when it comes to connection. Remember we talked about those 7 C's? It's really important for people to be connected. And there's tons of research that show that women create what are called kin environments, right? Even if it's not our family, we make a family. Women are really good at that. And I'm not generalizing. There's research to actually support this. Men are not as good at doing that. So it's really important when I'm interacting with families, when I'm talking to not just mom, but dad as well, I want to know who are his primary support systems. When I'm working with a mom and a dad and the mom has maternal depression, postpartum depression, I want to make sure that she's not his only support system. When you have an older child and you're going through a really difficult time, maybe the child has a cancer or failing in school or having a really tough time socially, I want to make sure that they don't just have each other, but they have some other people that they can rely on or talk to for advice, support, encouragement. So you can even go home tonight and ask your partner, who are your primary support people? Dr. Collins, yes?
So what do you do if they say it's you?
It's you. Well, what I would say, I tend to be a really frank person. I'd say, well, it can't just be me. You got to find someone else. But in a really nice way, you might say, you know what, I think it's important for you to have people that support you too. And, you know, often husbands aren't encouraged because they work full-time, and moms work full-time too, but sometimes they aren't always encouraged to have as many social groups, whether that be a card playing group or a golf group or a movie group or whatever it might be, but other places where they have social connections through their church, through friends, through community groups. And not only are they not encouraged, men just don't as easily delve into those, like I said, women are. And so it might be a matter too of just talking to your partner about finding some of those other resources. And it might even be your friend's husband or other people at church that you know. And again, if it doesn't happen, you can bring them to you, right? Create those groups and support systems at home through other partnerships. But it's important that you both have those people in your lives. Good question. The question was, I'm sorry, what happens if your husband doesn't have those or your partner doesn't have those people? So the life preserver analogy is something that Dr. Collins talks about at her office. And she's a pediatrician. She just got here fighting traffic, I'm sure. She talks about the life preserver analogy in her office. And to me, it's another way of talking about the circle of support. But she talks about it as, you know, who are the people in your life that are going to throw you that life preserver if you're drowning, right? Who are the people that are going to help you, and who are the people that you're helping? It's a really good way to talk to teenagers about their circle of support, right? Like who are the people that are really going to be there to help you out during a tough time? Another way I talk about it, in addition to the circle of support or life preserver, because I just want you to have lots of ideas about this, is I talk about islands, having different islands, and that we all kind of fit on different islands socially as kids when we're teenagers. Who's your island? Who do you fit with? And can you go between other islands? Do you feel like you're going to drown if you're in between them? Is there somebody that would throw you a life preserver if you were out there and drowning? So just different ways to talk about the same thing, which is finding those primary circles of support. Okay. All right, let's talk about another intervention. It's called special time, it's called floor time, it's called parent interaction time. It comes from parent interaction theory, as well as people like Stanley Greenspan, who we know when you spend one-on-one quality time with your kids, it increases their emotional IQ, their EQ, their emotional intelligence, increases their ability to talk about feelings, and it helps them with regulation skills. So one-on-one time is good for lots of things that help your child be resilient. One-on-one time has a basic premise. Happens 3 to 4 times a week, 10 to 15 minutes a day. So it doesn't have to be every single day for an hour with every kid, right? You never get anything done. But it's more about quality interaction time where you're fully present with your child. Turn off your cell phone. This is your time to not be a teacher, right? If I'm doing floor time with a 2-year-old and they say, you know, here's a giraffe and it's clearly a horse, I don't correct it, right? It's a giraffe. It's not a time to be a parent or a teacher. It's a time to just be fully present with your child, uninterrupted, and I always say, do something that is unstructured, in an unstructured activity. So nothing on a screen, not a video game, and not even a game with rules, right? Like Monopoly or something, but just, you know, for a younger child, it might be Legos, it might be dinosaurs or building things. For an older child, it might be sitting and painting together or drawing together while you're talking, or just kicking a ball back and forth while you're spending special time together. For teenagers, it gets a little bit trickier. I'll come back to that in a minute. But what you want to say to your child is, we're going to have special time today. And you can call it their name, or you can just say it's our special time. It's our connection time, whatever you want to call it. But you want to make sure that your kid knows that you're going to set aside time with them on a regular basis and be fully present. Especially now in our digital age, when we spend so much time doing this, we miss opportunities for connection. I strongly believe that when your child is acting out, they need more of you, not less of you. And I say this to teachers all the time. When kids are acting out in classrooms, they don't need to be sent away from them. They need to be pulled closer to them. Don't put them in the hallway. Put them in the desk right here, right? That goes for a lot of behavioral problems. And so this is one of those things, I'm getting a little bit off track, but giving you another little tidbit of parenting advice, right? If your child's acting out, they need more of you, not less of you. Don't send them to their room for a timeout. Say, you know what, you got to have a time in with me. I guess you're my helper now. Got to be right with me when I'm doing the dishes now, or making the bed, or folding the laundry, because you're having a really hard time managing yourself. So we're going to manage together for a little bit. We call that co-regulation. Kids don't love co-regulation being enforced on them, right? But it's important if you feel like you can't trust or manage their behavior for a period of time. We can't just trust we're going to send our kid to their room for a timeout and that they'll learn how to regulate their behavior. They actually learn how to regulate their behavior through you. I see that there's a question. Hold on to it for 1 second. So floor time, the premise of it is you give your child your undivided attention 3 to 4 times a week, 10 to 15 minutes at a time, and you are fully present with them. So let me give you a couple of examples of what this looks like. So I was in a pediatric office, and Mom was talking about a lot of behavioral problems that this 2, almost 3-year-old was having. And of course, they're delightful when I come in. But what I noticed is that Mom was often really checked out with the child and not present with him, and had never really learned how to play. Your kids will teach you how to play if you're fully present with them. And it can be very simple. So for instance, this child got up on the chair and he went over to the light switch and he turned it off. And I went, off, lights are off. And then he turned it on. I went, lights are on. And he smiled like, whoo, I'm having a cause and effect on this lady, right? What I'm doing has meaning. Remember we talked about competence, confidence, character development, right? And then he turned it off again, on again, off again, on. We did that for like at least 3 minutes. And the mom's watching this game of volley. That child at that moment is learning social regulation. What I do matters. She's paying attention to me. And then he hopped down off the stool and he started pulling all the tissues out of the box, right? Now, if it were me in my house and I was in mom mode, I might say, oh gosh, we're not going to pull all the tissues out of the box today. But if I'm in floor time mode, if I'm in special time mode, unless there's something unsafe or dangerous, it's okay. Because they're probably just trying to like have fun or do something silly. And a box of Kleenex doesn't cost me that much money, right? So he threw the Kleenex up in the air and we watched it fall, and we threw it up and we watched it fall. And I started to label his feelings. Like, you really like that. You look happy when we're playing together. And then he threw the Kleenex up in the air and I went, and the Kleenex blew across the room. And he was like giddy with excitement. And I said, wow, that surprised you. And that made you feel happy and excited. So I started to label his feelings. So now he has the present attention of an adult And we're labeling feelings, and we're narrating play. And I allowed Mom to watch this for about 8 to 10 minutes. Obviously, we had no behavioral problems at that time. He had my full attention. You can't always give your kids your full attention, but the research is very clear. The more we give our kids quality time and attention that they know that they can count on a regular basis, disruptive behavior will decrease. It's like putting money in the bank that you can withdraw later, right? That way you can say to your child, you know what, I know you really need my attention. I'm sorry, I'm busy like writing bills or doing things on the computer but remember, we're going to have special time tonight at 5 o'clock. You go set the timer right now, and you show your 5-year-old how to set the timer, or your 3-year-old. They all know how to operate clocks and watches. Don't tell me they don't. Clocks and microwaves, maybe not a watch. And they will go in and you say, don't let me go 1 minute past 5:10 because I need to have that special time with you. And they will hold you to it. And you will get more compliant behavior even while they're waiting because they know that special time is coming and they're looking forward to that special time. And it's just as important for moms to do it as it is for dads to do it. They need that special time with both of you. So, you could trade days. You can do every other day. You can say, I'm going to do it 2 days a week and you're going to do it 2 days a week. But giving your child that present, undivided attention. And like I said, the Kleenex example I use because it's so easy. With my kids, when they were toddlers and little kids, we had those slider drawers on our bathroom, and we would play ice cream shop, where they would like close the sliders on the bathroom door and I would ring the bell, ding dong, and they would say, what's your order? Because they were at Dairy Queen. We were at Dairy Queen. And then they would slide open the sliders and serve me ice cream in my hand, which was just shaving cream that they would squeeze into my hand into a fist, and then we would eat the ice cream, and it would be so funny. Doesn't have to cost a lot, doesn't have to be hours and hours, doesn't have to be going to Oaks Park 10 minutes a day, 3 to 4 times a week. What does that look like when they're older, right? Those of you that have, 13, 16-year-olds are like, we're not doing the ice cream parlor thing, right? This is what it looks like. I have a 13-year-old going on, I think, 30. And so I walk into her room, and I already know she's kind of grumpy and surly, which says to me, she needs more of me, not less of me right now, right? Behavior is a way of communicating. So I go into her room, and I lay down on her floor. And she goes, what are you doing? And I say, just hanging out. She's like so annoyed with me. But over a period of time, she also knows I'm not going anywhere until we have just at least a little bit of a talk. And so, I just might say, like, what's up with math? Or what happened about that thing with Nate the other day? Or, just what's up? Eventually, she'll give me some kind of nugget, even if it's just, Mom, you're so boring, or I can't believe you're doing this, or another eye roll. And then I'll say, you know what, I am so boring, but I'm here. I tell you about my day. And I'll just start talking about my day, which then she's like, no, I don't want to hear about your day. And she'll offer something about hers. But teenagers, you have to impose yourself a little bit at times, and then they'll kind of gain some learned helplessness and allow you to just kind of be present, which is what we want. Another really good thing with teenagers is driving, right? You're in the car, they're faced forward. You can turn the music off, or better yet, ask them what kind of music they like right now and what they're listening to, and offer to listen to their music. That's a whole bunch of stuff to talk about right there, what they're listening to. But sometimes just an opportunity to drive, right? I tell parents with teenagers all the time, take the long road home. You're leaving my office. I know your partner or your family is expecting you back at home. Take the 15-minute drive instead of the 5-minute drive. Stop and get a Starbucks. Just hang out for a little bit. So with teenagers, it's more so a matter of just being there and being available for them to talk to, versus younger kids, they're so much easier and willing to play with you and hang out with you. It's important, though, at every age. Questions about special time? Yes.
Does it need to be one-on-one, like with mom and dad separate, or can mom and dad do it together?
So the question is, does floor time have to be one-on-one? Like, can mom and dad do floor time with a child together, or should it be separate? If you have a single, it can be mom and dad together, although I still think it's important to have one-on-one time, right? But you can do a combination of any of those things. You can do and that it brings up a really great point, so thank you, which is do date nights with your kids where one of you takes one kid and one of you takes another kid. That's special time too, when you have date nights with them. But it can be together, it can be separate. It just needs to happen consistently and predictably for your child in order to develop that emotional bank with them. Good question. I know, clear back there, we had a question. Right. Yep. Yep. Well, a couple of things, right? So here's the question. She said it's especially hard with teenagers because there's just inherent conflict, right? They'd rather like shut the door and shut you out than have conversations with you. So you might, if you're not doing this on a regular basis with your kid and they're kind of used to being able to shut you out and you're a little bit maybe apprehensive or timid about approaching them because they send such clear messages. I get it, you guys, I get it. Teenagers are really good at sending you the message, I don't want you, right? That's why it's your job to continue to be there. But that if you haven't done it already, right, so you're starting this kind of new and fresh, you're going to have to take small steps towards that. So it might be just talking to them for a little bit in the car, or it might be when you're getting ready for dinner, just saying to them, why don't you come down and just, would you mind talking to me while I'm chopping vegetables? Or would you mind chopping some vegetables with me? Or would you mind just sitting here and having a, glass of juice while I, get things ready or want to set the table? So it might be like asking them to do a chore with you, something that you're doing in parallel together, before it's something like going in and laying on their floor, right? But I can tell you this for sure, okay? I've worked with lots of kids and lots of teenagers since, for 15 years now. The number one thing teenagers tell me, even really high conflict, difficult teenagers that I know you all think you have. I wish my mom talked to me more. I wish my dad listened to me more. I wish they talked to me without any judgment. Remember when we went way back to the things that are really important to me? Non-judgmental stance, unconditional love, shared language, common goals. Those are important for providers, important for parents, important that your kid know that about you. Because when I sit with kids in my office privately, what they say to me is, if she would have just asked, I would have told her. Or tricky teenagers say, well, if they would have asked a few times, they might have to ask more than once. But they want you to be in their life. And they're in this really tough spot, right? A lot of parents of teenagers, of juniors and seniors are like, God, why are they so horrible and grumpy and pushing me away all the time? Well, because guess what? You've been telling them their whole life they have to leave you and go to college when they're 18. So they're scared to death. And so what are they going to do? They're going to push you away before they have to actually launch themselves into this world where they're not going to have you anymore. So they're getting ready to individuate and become autonomous from you. It's a developmentally appropriate behavior for them to push back, to make sure, hey, I can do this on my own. So keep leaning in to them as much as possible. Does that answer your question? Okay.
What do you do in terms of working with the young kids? Do you tell them that it's going to be 10 minutes a day, 3 days a week? And how do you terminate that time? How do you end it? Because they're really having a good time. I mean, it's not going to want to stop.
Right, really good question. So the question is, do you tell them that it's 10 minutes a day, 3 times a week, and how do you terminate the time? No, I don't tell them it's 10 minutes 3 times a week because otherwise they're like little dictators. And then you've got a child who's like managing all your behavior. But I do want them to look forward to it. And I do want them to notice, hey, we haven't done that special thing. Remember when it was just me and you, Daddy? I like that special time, just us. I want them to notice. So I want you to be consistent enough that they miss it, for sure. And it's okay to say to your kids, sometimes we get in 10 minutes, sometimes we get 15, sometimes it's just 5, sometimes it's 2 times a week, sometimes it's 5 times a week. Because one of the things that's important for your child to build resilience is flexibility, problem solving, right? In order to be a resilient kid, you have to know that, things aren't always going to be exactly the same, right? It's a coping tool to be flexible. But I do tell them when it's starting and ending. And the reason is because we don't want them to feel like there's that love withdrawal that we talked about before. So I will say to my kids and kids when I'm doing floor time in my office, you know what, we're going to, if I'm talking as a parent, I'll say, you know what, mommy has about 12 minutes and then I've got to go do a mommy job after that. So it's 5:10. I'm going to watch my watch. I'm going to set it for 12 minutes. I'll give you a little warning when it's about 2 minutes. And of course they're going to be bummed because you're awesome. And they want that time with you. And so when that time is starting to end, right, you can say, I know, I'm bummed too. I'm really looking forward to playing with you again tomorrow, to having this time. It doesn't mean you don't play with your kids during other times of the day, right? I mean, you still might like go out for a family walk or play soccer with them, but often it's because you're running them to practice, or you're doing homework, or you're taking them to a tutor, or you're doing some other kind of structured activity. This is non-structured, completely present time that you're giving them, and that's going to feel different than any other time. But you can also reassure them, it's okay, we're still having family movie night tonight, right? Or we're still making pizza together, or I'm still going to tuck you in, or we'll do this special thing again later. But I do let them know when it will start and when it will end, especially when they're younger. Teenagers are like, see ya. We're done with that. Other questions about floor time?
Just as a thought that I've seen it work pretty well for a non-communicative teenager to receive texts from his parents and to respond way better in texting than in person. And it's quite a wooing situation where they got together through just knowing each other, texting, and then finally then they were doing things together.
Yeah, it's a great, so the comment was, she's seen a lot of luck in some dyads where you start this with texting, which might be a really good example for some of you that were wondering how you could start small with your child, just doing some text messages back and forth. It's a current age era of doing a journal, the things that we actually wrote in, remember? And I actually give that as homework assignments to some families, to start a mommy and me journal or a dad and me journal. And sometimes I'll just start it doesn't have to be anything intimate. It could be like, I saw this recipe today and I thought of you. Let's make this together. Or I saw this poem and it made me think of when you were 5, right? And just putting it into the journal, and then your child gets to write back to you. So it could be texting, it could be journaling, it could be emailing, but thank you for the comment, because it doesn't have to be one-on-one. It has to be about the importance of connection, and hopefully you'll build towards that one-on-one, very present time. Yeah. Okay. All right. Let's talk about yoki feelings. So this is an intervention that I talk about in my office all of the time, and I can guarantee you that 75% of you are going to be like, this is really corny, and I'm not talking about yoki feelings. And then you will all go home and you'll be like, we're talking about yoki feelings. And so we're going to talk about the intervention, and I'll tell you a really funny story. So yoki feelings is the way I talk to families about how to label feelings other than anger, right? All of you and some of your kids have had those days where, you know, everything makes you feel grumpy and angry and mad and hostile and pissed and all those types of things. And as psychologists, what we know is that those are all secondary feelings. So when I talk to families and kids, what I say is, imagine an egg. And if an egg is like representative of feelings that you express, there's that hard outer shell, right? It's protective. You got to kind of bump it or hit it or crack it to break through. And what's that shell protecting? It's protecting the egg, and specifically the yolk. And if you want to have all the birds and the bees talk about why we got to protect the yolk, that's different. But for the sake of this, we're just talking about feelings and the yolk. And so what I say to kids is, you know what? I hear you. You're really mad. And your mom says you get really mad, or your dad says you hit and bite and you throw things. So I just want to talk to you a little bit about anger and how we express anger, and how I bet if I help you a little bit, you could express that feeling in a way that would get you a little bit more help. And so this is what we talk about. Give me all the words that you have for angry. And so kids are really good at that part, right? They're angry, they're mad, and I'm writing all their feelings down as they're talking about it, because they're really important to me. They're frustrated, they're upset, they're furious, and all the behaviors that come with it, biting and hitting and kicking and screaming and throwing things, right? Okay. Did you know that we all have anger, and it's a real feeling, but it's also what we call a secondary feeling, or not a first feeling, it's a reactive feeling to something that we know is usually coming first, or that we feel primary, but we can't always access it. And the egg white is working really hard to protect it. And there's 3 major feelings that happen in there. Sad, worried, and confused. So I say to kids, have you ever eaten just egg whites? They're kind of bland, right? They have a lot of protein, they're really strong, but they don't taste very good. Really, the yummy stuff, that's the yolk. That's the gushy stuff. That's the inside stuff. This is stuff that, like, you know, we kind of try to protect from people, those sad, worried feelings. And so instead we lash out, we hit, we scream, we yell, we say, back off. When really inside what we're feeling is sad, worried, confused. And so I usually use an example at that time, and you can use yourself as an example. Remember that time you ran out into the street and I ran after you and I picked you up and I said, don't ever do that again. I was really mad. I screamed at you, and I bet that was really scary. I wasn't actually mad. How do you suppose I was really feeling? I was really worried. And I wanted you to stop that behavior immediately. So my voice got really, really big. But really what was happening is I was scared to death that something bad could happen to you. Does that ever happen to you? When you're feeling really, really mad, but you're actually worried? Or anxious or fearful, right? Other words for worry. Sad, disappointed, depressed, confused, overwhelmed. And often kids start to make those connections. I talk about yoki feelings. I can't even tell you, I have parents and families that I see for many years, and we start talking about yoki feelings at 3 and 4. And there are parents that come in with their 12-year-old, 13-year-old, and, you know, especially moms or dads that don't have as high of a feeling vocabulary as others are like, we got to talk about those yoki feelings again because we forget it all the time when we go home. And so here's what I tell kids. These feelings and the expression of behaviors that go with those feelings usually result in consequences. And what are the consequences usually? Usually your parent gets equally upset and angry with you, or you have a consequence for how you've just behaved. So, wouldn't it be great if that could feel different? What if instead we had feelings that we could express that would get us help? Because only in a really unhealthy parenting relationship do I say to a kid, if you tell your parent you're sad or worried or confused, what do? They usually help you. They try to organize your feelings. They come to your aid. They say, let's figure this out, or let me help you make this better, or let's find a solution to this, or gosh, I'm so sorry, I didn't know that made you feel sad, or I didn't know it made you feel that way. There are rarely consequences, again, unless it's a very unhealthy dyad, for expressing these primary feelings. But we all get caught in it, right? We all get caught in expressing the anger. I talk to kids about, having your dukes up. Like you have your dukes up when you're angry and you're ready to fight and it keeps people back. I get it, right? Why we get angry. It's protective. But if we want help and we don't want to keep people out here, we got to talk about these feelings. Okay? I had this big, strong dad who came to see me with his daughter for a really long time, and he had kind of an abrupt way about him, and they were both here all the time, fighting and conflict, and he was a single dad raising his little girl, and we started talking about this, and at first dad was like, really, you're gonna make my kid a wimp? But the more they talked about it, the better they got, the less conflict there was at home, because they were talking about genuine primary feelings versus having conflict about secondary feelings. Why does this help your kid be more resilient? Because it helps them connect with you. It gives them better coping tools, helps them develop their sense of character and competence about who they are, and that they have a skill set that they can communicate better. So it helps them with the ability to know, I can get over this and get past it. It doesn't have to feel bad all the time. I can actually get help. When I teach this to teachers and kids in school, the teachers say all the time, oh my gosh, this yoki feelings was my favorite thing, because if a kid can actually come to me and say I feel sad that so-and-so took my ball, or I feel confused about why so-and-so was like cheating off of my test. I can help them so much more than if they're acting out. So I told you I was going to tell you a story. I did this intervention with pediatricians. And again, like 75% of them were probably like, this is really cheesy and this is very much a therapist trick. And I called one of them a couple weeks later to talk about one of our mutual patients. And he was like, okay, but first, Yoki feelings. He's like, I use it all the time now. And I'm talking to all of my kids that are 6 to 9 about Yoki feelings. He's like, it's changing the way I'm talking to kids and families about feelings. It's completely different. And he hands out now a Yoki feelings flyer that he got at the training. And so it really, if we start talking to kids about feelings and language in different ways, will give them a different coping skill set that they can operate from. Questions about Yoki feelings? Lots of questions. Good.
So, does this apply to only anger, or do you have other example, or is this mostly what we face every day?
So the question is this: does this apply mostly to anger, or are there other feelings? The reason I use the Yoki feelings is specifically for anger, because the anger and all the synonyms that go with it is often the most misunderstood secondary feeling. So we lash out, we get angry, we get irate and overwhelmed, and people, there are behavioral problems, there are miscommunications in family, unhealthy conflict that happens in families. And a lot of you are sitting there thinking, like, I was raised in a really loud family. Like, we yelled at each other all the time. Like, there was anger everywhere. And think about how that might have felt different if there was a different way to talk about feelings and express emotion. So this is specifically for angry feelings, but you bring up a good point, which is this. Floor time, for instance, is a really important time to expand your child's feeling vocabulary. Kids whose parents communicate with them accurately about feelings and helping them label the feelings have better emotional intelligence later in life. They can cope better later in life because you're helping them expand their vocabulary. It helps them feel more understood and validated. I had a woman come to my office. This was years ago. She was probably in her mid-40s. And I kept asking her, well, how did you feel about that? Or what happened there? How did you feel about that? And she had no feeling vocabulary. I'm not kidding you. And I gave her a sheet of feeling words that had like 52 feeling words, positive, negative, everything in between. She just started crying. She said, I think I have felt every single one of these feelings, but I didn't have words for them. I see the words, I've never used them. And so thank you for asking the question, because whether or not it's with the Yoki feelings exercise, it's important to develop feeling literacy in your kids. You can do that through what we call bibliotherapy, right? Getting books about feelings. You can do songs about feelings. You can just talk about feelings. You can use narratives and movies to say, you know, like, gosh, what was happening there? And how do you think those people felt? And how do you think they solved that problem? And what would you do? And how would you do that differently? We call that a narrative approach to understanding things. Great question. Yeah. Other questions? Yes.
What if your child truly has no idea why they're upset?
So the question is, what if your child truly has no idea why they're upset? How old is this child?
5.
Yeah, I would say 5-year-olds often don't know why they're upset. Sometimes I don't know why I'm upset, right? It's your job as a parent to help be a detective. Here's an extra little technique for tonight. We call this the ABC of parenting. The antecedent, the behavior, and the consequence. So what you're seeing, the behavior, is what your child is doing, right? And they're like, I don't know why I'm screaming. And your job is to be paying attention to this, the antecedent. Antecedent means before. What happened before the explosion happened? Well, I asked you to turn off the TV. Or I told you to, I don't know if you guys have seen that really funny Facebook video of all the reasons why toddlers throw tantrums, like because it's raining. So often they don't know why they're upset. And apply that to your teenager as well, right? Filled with hormones, completely irrational people, right? They often don't know why they're upset. So it's often our job as parents to what I call organize their feelings and look for what was happening just before then, or what else is going on in your life that may have caused that behavior or emotion to manifest or to come up. You know what? Maybe it's because you're worried about that test. Or maybe it's because of the fight that you had with your friend yesterday. I wonder if that's why you're feeling so grumpy today. Or maybe it's just because you didn't sleep very well or you haven't had a snack yet. But it's our job as parents to help them develop the understanding of why they're feeling or behaving the way that they are. Does that make sense?
How do you go about approaching the topic? Just like over dinner? Is it after something's already happened? Like how do you bring it up with, your typical 5, 6, 7-year-old?
Right. So the question was, how do you bring this up? Like I said before, all of these interventions are conversations worth having many, many times. So as much as it pains my children, we have conversations about feelings all the time at my house. Like at the dinner table, we do what's called roses and thorns in my family. What was the best part of your day? What was the worst part of your day? You don't have to have a worst part of your day. You always have to have something you're grateful for. That's the rules of our family. That's our we culture, right? But I want to know what's happening in your day. And so whether that's a math test or a friendship or something that happened, and then I want to say, how did you feel about that? I know there are people here sitting in the room like, my parents never did that. They did not ask me about my feelings at the dinner table. Be the parent that does. Be the parent that does. And the more you do it and the more you practice it, the better you'll get. And at first you're going to be like, okay, how did you feel about that? And they're going to be like, well, I felt really sad. And you're like, this is working, right? Or they're going to express a feeling and you're not going to be sure, you're not going to know what to do with it. You're going to call one of your people in your primary circle of support and you're going to be like, what do I do when my kid tells me they're feeling this way? Throw out your lifeline. But in other words, start small. Start at the dinner table. Read a book or watch a movie and ask your kids how they feel about that or how they felt the character was feeling. It doesn't even have to be that personal at first. But start it and ask often about how your kids feel. What is the saying? If you talk about the small stuff, they'll talk about the big stuff, right? So the more you talk with them about how they're feeling on a regular basis, the more likely they are to come to you later when the big stuff is happening.